More cuts are coming to Oklahomans who depend on Medicaid for health care and mental health services. There are growing protests from health care providers and their patients to the increasing budget cuts, which were talked about during a public forum with two of the state's top health care officials. The Oklahoma Watch Forum with Mental Health Commissioner Terry White and Healthcare Authority CEO Nico Gomez makes clear the real impact on Oklahomans from ongoing state budget cuts.
2 years ago, as a result of not funding the maintenance money that we needed, 25,000 kids in Oklahoma had their services limited. 25,000. That's 25,000 families, and so while they may not feel it at the Capitol themselves, those families felt it. This year, with cuts that we're experiencing, we know thousands more are experiencing those cuts. Oklahoma families who maybe don't have the same voice or the same opportunities to make people aware, but families are feeling it, and we can't let this continue.
We're talking about a $1 billion shortfall at least, probably more. And then you got education. Is education a priority with legislators? How's that going to work? With public safety and transportation, where do we fit within the priorities in a very limited budget, which could be a very economically painful for our providers? And then obviously, if it's economically painful for our providers, it could be, from a healthcare standpoint, very painful for our what I call our MVPs, our most vulnerable people, our most vulnerable population, but they're the most important people that we really care for.
We're funded 46 per capita now, as I just mentioned. I'm not sure how bad it has to get before we decide that we have to change that. And if you're a family whose loved one is losing services, if you're part of the narrowing of that door, you're at a 10. And I look at the things that are happening as tragedies around the state, and we've unfortunately had some real tragedies in Oklahoma the last few months. The tragedy that happened in Stillwater, the loss of my friend and many of our friends, Mark Costello. These are tragedies that happen when we don't provide services.
If you were to predict what percentage cut you would face in fiscal 2017, what might it be?
I don't think it's out of the question to see a 5 to 10% provider rate cut. Those numbers are the having $1 billion, $2 billion less dollars to spend. I don't see how you're not going to have some sizable rate cut.
There is no cut that is going to happen to the Department of Mental Health and Substance Abuse Services that isn't going to result in someone losing a service. And rather than turning on each other and fighting about which person gets to lose those services, I think it would be much more effective for us to all work together so that nobody has to lose services.
We got to be able to make the right, smart investments in Oklahoma to have a healthier population. Part of that's education. But part of that's having a real conversation with the citizens about the kind of governments they want and the kind of government they're willing to pay for.